In this module, we will cover some practical ideas for delivering a lecture. First of all, it's helpful to arrive early so that you know where everything is. Make sure that you know the layout of the room. Make sure that you know where the bathroom is, the water fountain, the places where the light switches are, and so on. Second, bring your slides in at least 2 forms. I usually email my slides to myself and then also carry them on a flash drive. Sometimes you can email them ahead of time to the person that's preparing the presentation so they can already have the slides up for you on the monitor. Third, before you start the lecture, learn how to change slides, both forwards and backward. Use the pointer, how to use the pointer, and how to dim the lights, especially in case someone accidentally leans on the light switch and you have to turn the lights on again, or if you want to dim the lights to show an X-ray or histo slide. Fourth, rather than looking at the slides and facing the slides, it's better to look at the monitor so that you're actually facing your audience. That way you can gauge from their expressions whether they're understanding things, whether they're confused, whether they're bored, and so on. Using the mouse as a pointer is helpful because it will always show up. A lot of times with laser pointers, they may not show up on a high illumination screen, or the spot may be so small that you can see it but the people in the audience can't. And finally, keep a copy of your handout, of your slides, in front of you, printed either 3 or 6 slides per page. You may not need the slides in order to talk about any one slide, but keeping the handout in front of you lets you know what the next slide is and allows you to make smoother transitions. Here are some things to remember not to do when you are giving a lecture. First of all, don't put every word that you're going to say on your slides because people will read the slides and quickly become bored. Don't point at the individual words on your slides as you say them, and particularly don't circle the words as you say them. Don't try to say everything that you know about the subject because your audience will become confused and bored and will very quickly tune out. So remember that less is more as far as helping your audience to remember things. Next, do not speak in a monotone or in any sort of oratorical voice. Try to speak in a conversational tone as though you are speaking to individual members of the audience. And finally, don't pack the material in so tightly that you have no room for interruptions or questions. If you're speaking in a situation where the audience can ask you questions during the talk, you don't want to stop to answer a question and then find that you don't have enough time to finish your talk and have to rush to get it done. And similarly, you don't want to finish your talk at the last moment and have no time for questions at the end. Now, as far as preventing stage fright, what are some ideas? First of all, I think the most important things are to know your topic, to be an expert on it, and to practice your talk aloud and have timed it. And these 2 things are very calming because then you feel in control, you feel like you know your topic well and can answer questions that people are going to ask, and you have the reassurance that your talk is not too long, that you will not have to rush. As you are practicing your talk, which you should usually do several times for a brand new talk, try to imagine that you're sitting in the listener's place. Try to listen to your own voice and to note what is not clear, what sort of things people might have questions about, and if you think of questions that they might ask, look up the answers and be ready to answer them. Another way to help minimize stage fright is to make sure you arrive early and or even scope out the room beforehand, before the day of the lecture. Know the size of it, the arrangement of the chairs, and try to imagine what the room looks like full of people. Next thing is to try to create a one-on-one atmosphere. Don't think of yourself as talking to an audience of 160 medical students. Think of yourself as having 160 one-on-one conversations. Oftentimes it helps to Speak particularly to the people in the first few rows because they may be the ones that are most interested. In any case, try to speak in a conversational tone and be yourself. For instance, if you're not a funny person, don't put on a funny persona during a talk, because then what will happen is the audience will laugh at your jokes only because they feel sorry for you, and you'll appear pathetic. Finally, pick out people in the audience that are looking at you that seem to be particularly interested, and as I mentioned, oftentimes those people will be in the first few rows, and imagine that you are talking to them one-on-one. And finally, some miscellaneous suggestions. How many slides should you make? People ask. And this depends a lot on the amount of information on your slides. Is it just a few bullet points? Is it a graph or a figure that needs to be carefully explained? The spread of knowledge in your audience makes a lot of difference. If you have a wide spread, you may have to go over very small details in your figures, such as explaining what the y-axis is and what it means, and the x-axis and what each of the points means. And another thing that determines the number of slides is whether or not you will welcome questions during the talk. Many people will give you a guideline of 1 slide per minute. For me, that's too many slides. I'll oftentimes, for a talk where I'm actually transmitting a lot of information in a class, use anywhere between 25 and 40 slides for an hour talk. But you have to, that's the importance of practicing the talk so that you know how many slides to have. Remember to allow extra time at the beginning in case you get a late start, which is probably going to happen, and extra time at the end for questions. And finally, very importantly, revise your talk immediately after you give it while feedback is fresh in your mind. When you remember the things that weren't clear as you said them, when you notice the typos or things that you could have done better. Because if you wait until the next year or until you have to give the talk again, you probably won't remember. That's it for this module, and in a future module we'll cover some examples of PowerPoint slides, things that work well and don't work well.